All right, so we're going to talk now about cystic fibrosis. Cystic fibrosis is an autosomal recessive genetic disorder. It's the most common in people of European descent. And what it causes is abnormal composition of body fluids. It affects the electrolyte levels of body fluids. So there's increased electrolyte loss in sweat. And one of the tests for this is actually measures how much salt they're excreting in sweat. And it also causes increased viscosity of the mucus, and that's what causes the pathology. So in the respiratory system, we see that, and that's where it becomes deadly soonest. It leads to recurrent pneumonia and then chronic pneumonia and progressive obstructive emphysema because of the damage from those repeated infections. So the mucus is so thick and sticky, they cannot get it up, and it sits there and it gets infected. Okay. In the small intestine, it can lead to Meconium Ileus. So if you have a baby that's not passing meconium in the first few days, this is one of the things they look at. It leads to chronic constipation, which can cause rectal prolapse. Okay. In the pancreatic duct, it blocks pancreatic enzymes from getting into the small intestine, which leads to malabsorption, failure to thrive, steatorrhea. They have a really large, bulky, fatty stools. Degeneration of the pancreas. The pancreas is damaged, and that eventually can lead to diabetes. Typically, they're insulin dependent. It's not really type 1. They may have some insulin resistance, but it's not quite like type 2. It's a diabetes caused by pancreatic damage, and they typically require insulin. The bile ducts are blocked by this thick mucus, and that leads to biliary cirrhosis and portal hypertension, and the reproductive tract, which leads to infertility. So we think of this as a respiratory disease. It's actually an entire systemic disease, but the most dangerous manifestations are in the respiratory tract. So diagnosis, the newborn screen actually identifies kids who are at risk, and a sweat chloride test is used for diagnosis. To manage pulmonary problems, first priority is to prevent and treat pulmonary infections because they cause scarring, and that leads to pulmonary damage. So cystic fibrosis patients need to avoid exposure to respiratory infection. They may need to avoid other cystic fibrosis patients who are colonized with specific organisms, which can be really a challenge because that's often their primary social interactions with other kids with the same disorder. They get lots of antibiotics. They can be IV or aerosolized or both. Usually IV antibiotics are during an acute infection. Another thing that's done to try to prevent those infections is airway clearance therapies. So this is scheduled several times a day, and they get these more often when they have a respiratory illness. Typically, they get a bronchodilator administered first, then they may get a mucolytic, nebulized mucolytic, which breaks down the mucus. Now, that's different from an expectorant. An expectorant like guaifenesin just pulls water in to thin the mucus. Mucolytics actually chemically break down the mucus because it's so thick they can't get it out otherwise. A couple of those that are used are Dornase alpha and acetylcysteine. You've heard acetylcysteine before. It's also the antidote for acetaminophen poisoning. They may also get nebulized hypertonic saline to pull fluid in and try to get that mucus up. And then this is kind of like these things are grouped together. So we want to open the airways, break down the mucus, and then they do chest PT, postural drainage, breathing techniques. They have high frequency chest compression vest, or vibrating vest that try to bring up that mucus, and that's done several times a day. Oxygen should only be given as needed to maintain adequate saturation. Giving oxygen too much and too early actually contributes to cellular injury, and they should be encouraged to exercise to their tolerance because that increases lung capacity and slows down the progression of the emphysema. So that's what they do for the GI problems. We also need to manage for the respiratory problems, we also have to manage their GI problems. So all meals and snacks should be accompanied by replacement enzymes. Those capsules should not be opened or crushed. There are formulations that can be given to kids who can't swallow a pill yet. So don't just take a regular pancreatic enzyme pill and open it. So they have to be given with all meals and snacks that allows them to absorb some of the fats and proteins that they're consuming. They need a balanced diet, but they need extra calories and extra protein because they lose a lot of what they take in. So they have absorption problems, but they also use more energy and more protein for healing. So high protein, high calorie, balanced diet. We want these babies, if the mothers breastfeed, we want them to breastfeed as long as possible. If they're breastfed, they still need enzyme supplementation, and they may need to be supplemented with high calorie formula if they're not getting enough in. All fat soluble vitamins need to be supplemented. Which ones are those? Okay, if they don't absorb fat, they have a hard time keeping those fat soluble vitamins. If they're not able to keep up with their nutritional needs, they may be on tube feedings or enteral feeding. Usually those are given overnight so that during the day they can eat more. For constipation, Miralax or Colite. For rectal prolapse, it needs to be reduced as soon as possible. And we want to try to avoid that by avoiding constipation. Okay, now they also have endocrine problems. So their blood glucose is monitored. Usually when they develop diabetes, it's managed with insulin. Glucose management can be more difficult because they have malabsorption. They don't absorb everything, and they need bone density. They need bone density assessment because of the absorption issues, but also because they end up on steroids some of the time. Median survival at the time your book was printed was about 40 years. I believe it's been extended past that now. Various organs can be transplanted to increase that survival rate and extend that lifespan, but the transplanted organs are also going to be affected by the disease. So they may get lung transplants. If they have right side heart failure from the lung disease, they may get a heart transplant. They've been trying to do pancreas transplants. They may get a liver transplant, but all of those organs, the new organs, are still going to be affected. So they tried to do those later in the progression so that it's going to last longer. There is gene therapy available for patients who have a specific gene mutation that opens the chloride channel and allows for less thick, sticky mucus. Nursing care, this patient needs comprehensive collaborative care. We might be administering meds and therapies. We're going to be monitoring for complications and side effects, lots and lots of teaching, lots and lots of support. And then we may be in the position of supporting the family through that transition to adulthood. We want to help them find ways to be independent. And then we may be supporting the family through end-of-life decisions and care. Okay, in the next section, we're going to talk about COVID.